Okay. So what we're going to do here, you're going to typically do on the floor. And what we want everybody to be able to do is we want everybody to be able to find ideal positioning and then stabilize the body and then do a movement. And all of these things are really important. So and what I also want you to do is before you do any activity, I want you to run through this. So before you go and drive some balls, before you get on the treadmill, before you do the squat, I want you to do this because if you bring this to the front of your mind before you do the activity, then you build the motor pattern that we're trying to establish into the body. Okay? Okay, so you're going to bend both your knees. And what you want to do is you want to get your feet in a position as if you were standing on them in a strong stance. So a bit wider. So we're looking kind of like that, like hip width, and here about 90 degrees in the knees. So you kind of see that positioning here. And where we're putting you is we're putting you in a position of strength. That's where we want you to be. Then what you're going to do is that you're going to tilt the pelvis backwards and forwards like that. And then go the other way, good. And go back, and good. And the one thing that we do want you to do is we want the motion's kind of ratchety. We want the movement to be a bit more beautiful than that. So go ahead and do that. Good, that's much better. You know, we always want slow, beautiful movement. If you see an animal running, that's kind of the movement kind of stuff that we want. Then hands at your sides. And we want kind of the shoulders in a nice wide position. Like that. And then the back of the neck nice and long. I'm going to lower this just one click. And what you're gonna have to do is you're going to have to put something in back of your head to lift it up a little bit, and you do that little chin tuck thing that I just did, where that's probably too much what you just did, so probably there. So you feel like you're making this part of your neck longer. Okay, so that's the alignment, and the more that you're aligned, the better. So now we're going to use a strategy that we call the Powerhouse to help stabilize the body. And this Powerhouse is going to be a combination of three things. First, it's going to be breathing in a specific way. Then contracting a deep abdominal muscle called the transverse abdominis, and then contracting the muscles of the pelvic floor. So first the breath. It's going to be in through the nose, out through the mouth, through pursed lips and tongue. And what you're trying to do with really the tongue is you're trying to slow the air from coming out. So it's going to look and sound like this. Shh. Can you show that to me? Perfect. Okay. So now, abdominal muscles. We have three layers of abdominal muscles. We have the rectus abdominis, the abdominal obliques, and the one we're concerned with right now called the transverse abdominis, named because it goes transversely across the lower belly. And what it does is it tightens the lower belly, and that is going to help us be more stable. So if you take two fingers right here, right there, and then you come just inside that pointy hip bone, and I'm going to do the same thing on this side. So now what I want you to do is I want you to take that breath in, and I want you to now tighten muscles down here. Shh. Feel that? You got it. You did it even without the breath, which is exactly what we want to happen. Shh. Good. Okay. Now the muscles of the pelvic floor. So pelvic floor muscle is here. Urethra, what we pee through. Anus, what we poop through. Both pass through it. When you contract that muscle, it moves up towards your head, and you'll feel penis, testicles, anus tighten and move upwards a little bit. Two cues to help people get connected to their pelvic floor is one, stopping a pee in the middle of peeing, but we don't want people to do that on a regular basis because that does promote urinary tract infections. And the other one is holding in a fart. Okay? So now let's combine all three of those things. So now it's that breath in. Go ahead, palpate here. Breath in, draw in, and lift up on the pelvic floor. Can you feel the pelvic floor contract?
Yes.
Yes. Okay. One more time. And then breathe out. Good. Awesome. Okay, so that's the stabilization. Like I said, that whole thing is what we need to build into your whole body. And now one of your questions might be, hey, why do I got to stabilize? I'm trying to get more range of motion. The reason is that part of the range of motion is lost because the body won't let you get there because it doesn't feel safe because you are not stable enough. So that's why the stabilization is so important. It make sense?
Gotcha.
Okay. So now let's add some motion into this. So what we're going to do is we're going to add hip motion. The only joint we want you to move is your hip joint. We don't want you to change the position in the spine. We don't want you to change the position in the knee. Okay? So what it's going to look like, you're going to take a breath in, you're going to engage, leg comes up, and then you're going to stay there. Breath in again. And then breathe out, engage, leg comes down. Switch to the side. No. Remember, you keep that same amount of bend. Okay, let's switch to this side now. Breath in, engage, leg comes up. Breath in, breathe out, engage, leg comes down. Yep, there you go. Keep trying to keep the knee in that same position. Breath in, shut up. And go just to right there.
Yes.
Okay? Breath in. Leg comes down. Perfect. Back to the right side. Breath in. On the breath out, you move. Leg comes up. Awesome. Breath in. Breathe out.